Solving sleep related issues, giving such patients sound night sleep, I don't think there's anything better. There's anything better which can be satisfying more. And as a maxillofacial prosthodontist, what I've realized is there are very simple yet extremely effective solutions that I can give. Mouth breathing aggravates this problem, especially in children, where children, if they are mouth breathing, the parents have to be very aware of the situation, because mouth breathing can direct how the jaws can grow. Mouth breathing can make your jaws narrow, probably giving lesser space for the tongue, which can show up into breathing disorders later in their life.
Welcome to Slumber Sense Podcast, a space where we unpack the things that quietly shape our health, energy, and everyday lives. Sleep is something we all need, yet so many of us aren't able to get a good night's sleep. This is our very first episode, and we are excited to bring to you a whole series of conversations around your health and well-being. Today, we start with sleep as an important subject, because we believe you sleep well, you live well. Our topic of discussion today is sleep apnea, a condition many people live with for years together without even realizing it. Today we will be dwelling into oral health, breathing, and the way our muscles function play a much bigger role than all of us can imagine. I'm joined today by Dr. Mitesh Lodha.
Hello everyone. Myself, Dr. Mitesh Lodha, Maxillofacial prosthodontist and an implantologist by profession. I have keen interest in solving sleep related issues with the help of oral therapies and oral devices.
Thank you, Dr. Lodha, for joining us today.
Pleasure.
It's my pleasure to introduce Dr. Lodha. With over 15 years of professional experience, Mr. Mitesh Lodha is dedicated to redefining oral and sleep health through precision-based, minimal invasive intraoral therapies. His work is managing sleep apnea and snoring, which reflects a broad vision. His shift from isolated dentistry treatment to holistic preventive and life-enhancing care speaks volumes about his knowledge. He is based in Kalyani Nagar, Pune, and through his practice, Dr. Lodha strives to align clinical excellence with long-term patient well-being. On behalf of Slumber Sense Global, I extend a warm welcome to Dr. Mitesh Lodha. Thank you for joining us.
Pleasure is mine. Thank you for having me.
So let's get started. My first question to you, doctor, is what first pulled you into working with sleep and breathing and not just dentistry?
So, I don't know, but I don't think anybody in this world would have not experienced a bad night's sleep. It could be stress, it could be maybe not a comfortable bed, it could be a petty thing like a mosquito, but the day after that night can be really horrible. It can drain you out completely.
I agree.
Imagine there are some people who are living this weeks, months and years, what they might be going through. So solving sleep related issues, giving such patients sound night sleep, I don't think there's anything better. There's anything better which can be satisfying more. And as a maxillofacial prosthodontist, what I've realized is there are very simple yet extremely effective solutions that I can give. So that shows the way as to why I got into this.
So doctor, at what point did you realize that sleep apnea was way common than people thought?
Show me someone who's never heard anyone else snoring ever in his life.
Yeah, I totally agree. My husband keeps complaining that I also snore.
So, but that does not mean that every person who snores is possibly a sleep apnea patient. But extensive snoring that happens daily, very loud snoring, definitely shows that there is some underlying breathing disorder during sleep. Now, you look around, how many people have such an issue? I don't think it needs very fancy mathematics or extensive statistics to really understand that sleep apnea or sleep related breathing disorders is a big problem. Look around, connect the dots, you'll have your answer.
True, very true. When people hear sleep apnea, what do they usually get wrong?
Good part is that sleep apnea, the term is gotten a little popular, but still people think snoring is sleep apnea, and as snoring is so common, sleep apnea is equally common. So I wouldn't say people get a lot of things wrong. It's just the consequences that can be really extensive and really bad is what people don't really get. So people need to go beyond snoring and look into if they are suffering from sleep apnea, and probably take the consequences seriously and take some step.
Okay, so you mean to say snoring is just one signal, right? There are a lot of other factors that need to be, or parameters that need to be checked.
Correct. But snoring can be a starting point where I would say extensive loud snoring, gasps of breathing which your partner notices at night. That is what the sign would be.
Okay. So as we move forward, we've realized that snoring is just one indicator.
Correct.
Right? So how often do patients come in for dental reasons and leave realizing that they have sleep issues?
A lot of dental signs, oral signs suggests that there could be some sleep disorder. When we talk about sleep apnea, it is just one diagnosis.
Okay.
I would rather say a lot of dental oral structural signs show that there could be some underlying sleep disorder. The catch is not probably able to find them. As a dentist, what I've realized is, or from a medical professional point of view, I've realized that as the awareness is not as much, people's ability to take in that there could be something like this is what is lacking. And I'm happy that people like you are taking up this topic, going online and going on the social media, which is probably going to spread a little more awareness.
Right.
And I hope more people ask us, our patients ask us more questions than we ask them more questions.
Okay. So I have heard a term called myofunctional dentistry. Can you elaborate a little in common terms, for our audience to understand?
Sure. Myo means muscle.
Okay.
Functional is how the function is carried out. So myofunctional dentistry is anything where the muscles can be used to train the growth of your jaws, the position of certain structures of your mouth, muscles of your face, throat, mouth, oral areas. All of these can be trained in a specific way so that we can have the structures growing and adapting to the more corrected positions where we would want them to. So that is how myofunctional dentistry is. Obviously the dental and the areas are protected.
Oh, that's beautiful. That's something that even I was not aware about.
Okay.
Thank you, Dr. Mitesh, for enlightening us on that particular subject. Thanks so much. So going forward, how do things like tongue positioning or mouth breathing affect sleep?
Let's understand actually breathing, the sleep and the oral structures, how they are connected. Basically, our tongue is a muscle.
Correct.
Now, if I tell my audience that when you're deep asleep and somebody lifts your hand, what will happen? The hand falls down. Am I right?
Yes.
Because we've lost control over our skeletal muscles.
Correct.
The muscles that we can control.
Correct.
Anytime a person goes into deep sleep, tongue is a muscle, the tongue falls behind. We have a specific thickness of our airway, and when the tongue falls behind, the airway is reduced. Through the reduced airway, when somebody is trying to breathe in the equal amount of air, The resistance is what is causing a lot of friction, which is basically snoring.
Oh,
Now, if your jaw sizes are narrowed, if your teeth are crooked, your tongue is extremely large and does not find sufficient space inside the oral structure, what happens is the tongue is already gone behind, even when the person is a little awake. On top of that, now imagine that the person goes into deep sleep. The airway becomes so narrow
okay.
that the breathing stops. The brain quickly gives a signal to our
The muscles.
awakening system, get up, get your tongue ahead, otherwise you'll die. It's as simple as that. Mouth breathing aggravates this problem, especially in children, where children, if they are mouth breathing, the parents have to be very aware of the situation, because mouth breathing can direct how the jaws can grow. Mouth breathing can make your jaws narrow, probably giving lesser space for the tongue, which can show up into breathing disorders later in
Later
their
on
life.
life.
Also, what mouth breathing causes is when you breathe through your nose. Whenever someone tells you to breathe deep, it's through the nose that we breathe. Because breathing through the nose is the natural passage which can create a good amount of pressure, which can create that airway space to open up a little more. Our mouth breathing cannot do that. Plus, it does not, the mouth breathing, the air is not humidified. It is pretty dry. That dries up the entire oral throat area. And that is how mouth breathing actually aggravates the leading to sleep disorders or probably sleep apnea.
Well, that's an elaborate
Thank you.
description of what actually happens.
Yes.
So you have your tongue as a muscle, which drops when you are sleeping. It blocks your air passages.
Correct.
And that's one of the reasons that you snore. I'm sure that not many people are aware about this fact.
Exactly.
And the fact that breathing through your mouth dries up the passage, and it's difficult for the person to
Have effective flow of air through the dried area.
Yeah.
So, I don't know, you ask people, a lot of people will associate snoring something to do with the nose.
Correct.
Not a lot of people will realize it's the tongue that's the culprit. So that's something that you will be able to. It's more because of the tongue and less because of the nose.
Oh, that's eye-opening. Thank you so much for elaborately discussing this. So, like you discussed, or you were elaborate, like I said, you say this disorder also affects children,
Yes.
right? So, what are the indicators that parents should be aware about when they are monitoring their children's asleep? Can you just throw some light on that?
So it's not purely how they sleep. It's a lot to do with the geography, I would call it.
Okay.
To make it easy for our
Audience to
audience.
understand. Okay.
It's the anatomy. In terms of maps, I would call it the geography. Is how their structures are growing, how the teeth are, how the jaw shapes are. Good part about taking care of the children's jaw sizes and growth during their growing age is that the term that we discussed, myofunctional orthodontics, we discussed myofunctional dentistry. Myofunctional orthodontics is a part of myofunctional dentistry, where the muscles can be trained in such a way that the jaw growth can be modulated to whatever we desire to get through. So if you are having your children probably snoring at night, which is a little uncommon in children, you should really get into getting them assessed. If your children are having narrow jaws, probably cross bites. Cross bites are basically, if you see, the upper jaw is always ahead. Correct?
Okay.
If something like this, you have to take care of that. If your children are having habits like thumb sucking,
Yes.
tongue thrusting beyond a certain age,
Yes.
beyond probably 4-5 years of age, That's all that is going to affect the geography, the anatomy of your tooth and the jaws. So that is where the parents can really take care of, because if the growth can be modulated, the correction required later on in the life is going to be much lesser.
Easier.
Probability of them going on to severe form of sleep disorders like sleep apnea is going to be lesser. Now that does not mean somebody who is an adult like me cannot get their sleep apnea corrected. They too can get their sleep apnea corrected. They might have to get their jaws expanded, their teeth aligned well, probably have good amount of space for the tongue to rest into a position which is slightly ahead against the upper palate and not fall behind or not get squeezed inside the jaws. So all of these little things can be definitely done. There are a lot of devices as well, mandibular advancement devices, we call them MAD. Probably we would discuss more of it later on in the podcast.
Okay. So thank you again. Starting early is what you were saying.
Absolutely.
Right? Would make a lot of difference. I don't think our parents were aware, because you can see my teeth, they're very badly aligned. So there are points, like you said, the way your child breathes while he's asleep, the way if the thumb sucking habit is there. Okay, so these are minor things that can be observed, very easily observed by parents.
Correct.
And early actions could help them in the long run, right? That would
Yes.
benefit their child.
Yes. So early actions, how do I explain it in simple ways to my patients is, do you want to flow with the nature or to flow against the nature? So when the child is growing, all that you have to do is guide that growth, is myofunctional therapy. That is flowing with the nature.
Yeah.
Now when the child has grown into an adult with a specific shape and the growth cannot happen more, you are altering the nature, so you're going against the nature. Going with the nature is always going to be much better than going against it.
That's a brilliant point. Flow with the nature.
Yes.
So as we go forward, you have so much of an experience. Can you share a story where you helped somebody sleep better and they've come back to you saying, Doctor, aapne to meri zindagi badal di?
Definitely, a lot of stories. First, let me introduce, as a dentist, as a prosthodontist, what kind of appliance that we provide. So, this is the upper jaw, this is the lower jaw. As I told you, the lower jaw is usually behind.
Yes.
And the tongue rests here like this.
Correct.
Whenever we sleep, we are vertically this way.
Yes.
And the tongue falls behind. People having these narrow spaces, the tongue falls behind more, obstructs the airways more. Now there are these devices are called as mandibular advancement device. The short form is MAD. And
that's easier to remember.
Yeah. And we use the word MAD or the device MAD. So use a device MAD so that you don't go mad, is what
that's nice.
we usually say. In a mandibular advancement device, what do we do is just take the mandible forward. So there are plates like this which are worn onto the respective jaws.
Okay.
And the lower jaw is held ahead with some attachments on both the sides. Now when the lower jaw is ahead, obviously the tongue is pulled ahead.
Yes.
The tongue falls behind lesser. The airway remains patent more. And that is how these devices can help people breathe much better. Now, obviously, these devices are not applicable to absolutely every patient with sleep apnea. Sleep apnea could grade from mild, moderate to severe.
Okay.
These work very well with mild and moderate cases, which can help avoid them go to severe forms. They can also be used along with the BiPAP, CPAP machines that people usually use. Problem with BiPAP, CPAP in the severe cases, the amount of pressure of air that needs to be used is really high to keep the mouth or the airway open. And using a mandibular advancement device, in addition to a BiPAP machine, the pressure required reduces significantly. That is how using BiPAP, CPAP, in addition to this, can become much easier. Now let me discuss, or let me tell you a story of a patient that we had just last month.
We would like to hear that.
So we had given him a mandibular advancement devices a couple of years back. This guy is an Indian origin guy working in Saudi Arabia, somewhere in Middle East.
Okay.
Extremely difficult situation from the point of view of sleep, sleep disorder and breathing issues. He was really happy with the device that we gave him. He's off his BiPAP machine since then. Probably in the month of October, November, he had a new house help at his place who accidentally threw away the device, knowing it must be trash. I do not know the background story. This is what the patient has told me. Now that poor guy is in Saudi Arabia. He's not found a right person to get a device like that made. And this guy is not able to sleep horizontal since then till the time he could make it to India.
So he was sleeping vertically. You mean he was sitting and
yes,
sleeping?
More or less he was probably on his couch is what he was sleeping for so many days. There are such people. Probably we just do not know because sleep happens into a very personal space.
Correct.
He came to me, probably we got his scans done. We got a mandibular advancement device made. And on the dental chair, the amount of problem what I would want to explain is he cannot even lie down
on the dental chair,
on his bed, let alone sleep. Lying down also chokes him. And the moment we put in the mandibular advancement device, he could lie down 5-10 minutes without any choke. So when you see such changes and you can see the satisfaction what the patient has, I don't think there is a bigger reward that can probably have a feel of a reward than to give people such relief from their terrible problem.
There's nothing more than a good sleep. And if you are correcting that, without putting the patient into any kind of trauma or any kind of, stress.
Yeah, so exactly where I would want to interrupt you is these devices totally removable. There is no invasion into any of the structures, no surgery, no cuts. I mean, least invasive, most reversible procedures. That's all that I would like to say.
Science has developed so much that it is helping us correct what we have forced to go wrong.
Correct.
Right?
Correct.
So as you explained to us, there was within 15-20 minutes that he was with you, lying down, he could lie down, and that must have been such a big relief for him after so many years that he could lie down and breathe.
Correct.
Right? So this is a live example that you have seen, but patients must be coming back to you. So what is the first thing that patients come and tell you after you have treated them for their sleep disorders?
So probably what the patient notices before giving a device like this is the first thing that they notice is loud snoring. That loud snoring is reduced. Okay. That's the first tangible sign for the patient to realize. People having real difficulty in sleeping, not just snoring, but difficulty sleeping, or their sleep getting disturbed because of these, because of these airway obstructions, they find more corrections into their sleep patterns. They can sleep longer, they can sleep without disturbances is the second. These devices come with slight adjustments, probably getting habituated to them. They could be feeling a little full in the mouth for a few days, maybe a week or so. Some discomfort where the jaw is held ahead.
Yeah.
And in the morning, taking the jaw behind sometimes can become. Okay. But these are just minor. The initial, probably a week's hiccup, against which the advantage that it provides is tremendous. So Yes, if you're using it for the first time, the first week can be difficult, but trust me, the way after that is super smooth.
Okay, so everything that you start first feels a little cumbersome.
Correct.
That's what you're trying to tell us.
Correct.
But as and how you start getting used to it,
Correct.
It becomes a habit.
Correct.
Right? And that habit helps to improve
Correct.
what you were facing.
Correct.
Correct?
Same like what happened to me when I used my spectacles for
Glasses.
the first time. My my nose felt really
Heavy.
My ears felt bad. But when I realized that I'm seeing better through it, I eventually got used to it. Yes.
Okay. So it's a matter of habit basically.
Absolutely.
Which will help you in the long run.
100%.
That should be the aim.
Yes. Yes.
Okay. So good habits make you live longer. That's what you would like to say?
Yes. Very cliched, but yes.
Yeah, I truly believe that. As a sportsman,
Yes.
I believe that having good habits would add more years to your life and good years to your life.
It's very simple to say, but not easy to follow.
Practice. Okay. So, as we move forward, what are the red flags you think that people in general should pay attention to where sleep is concerned in themselves as well as the children?
So, when you ask this question, it reminds me of my late grandfather.
Okay.
So, probably that was the time when I had not already become a specialist into this field. And when I look back, when I study the science now, and when I look back at him sleeping, is what I realize what he went through. Let me just put it forward.
Yes,
and
please.
I'm very sure that your audience will be able to relate one or few of these things. So usually, how does snoring start? Snoring is what I would want to be considered as
Main red flag.
a red flag.
Yeah.
Snoring, not probably once in a while, is okay, but if it is persistently, consistently happening, really loud snoring that can disturb someone else's sleep, or the sound is heard somewhere outside, should be a red flag. So what happened in my grandfather is, whenever he used to sleep, he immediately used to start snoring.
Okay.
The snoring used to go on increasing in terms of volume, goes on increasing, and there used to come a point where there used to be a big gasp of air that used to be associated with him moving, showing that he is disturbed in his sleep. So exactly as I explained to you earlier, is when he falls asleep, the tongue is starting to fall behind.
Correct.
The airway is narrowing.
Correct.
Snoring is started. More sleep, deeper the sleep, the tongue is falling behind. Airway narrower, heavier the snoring, and eventually it comes to a point where the tongue is completely fallen back. The person cannot breathe. The brain awakens the body. The tongue falls ahead. Patient starts to breathe. It's not that probably the patient is awakened completely in such cases.
Yes.
This might not be a severe form of sleep apnea.
True.
That is how somebody goes into sleep apnea, is what I would want it to say.
Okay.
So persistent, chronic, loud snoring should be one
It's a big red flag.
red flag. Second red flag would be my family, even my grandfather was very proud of himself. And when you ask me why, I would say that it was that he used to say, I can sleep absolutely anywhere, any time of the day. He was a little hard to hearing, but that was not the only reason, as he had not had sufficient deep sleep
Correct.
during the night.
Correct.
Is when he was used to feeling sluggish, not
During the
having
day.
not having sufficient energy during the day. And the moment he probably gets an opportunity to lie down, he could fall asleep because he was not completely recovered from his tiredness. So having sluggishness, feeling tired, not able to probably have good attention to the specific work that you're doing are good red flags. Another red flag, not necessarily a red flag, but could be, is people who take a lot of caffeine in form of coffee.
Okay.
And without the caffeine, if they are feeling sluggish, not necessarily they would be having sleep disorder, but it's worth looking into if whether they have sleep disorder. So all of these are good signs.
Okay.
Maybe not red flags, but definitely the yellow orange flags
Indicators, you're
where
saying,
they
yeah.
should at least stop and assess
Yeah.
if they are having such an issue.
Okay. How about children?
Children is again, as I told you, snoring.
Yeah.
If they are having a family history where somebody else is having sleep apnea, they could be at a higher risk.
Yeah.
Probably nowadays, if you've seen, children are going out less, physical activity is reduced.
True. I
That
agree
is
with that.
leading to a lot of childhood obesity. Obesity is one factor that I've probably missed out in mentioning. A lot of fat deposition along the
on
neck.
the neckline.
That also compresses your airway.
Okay.
So probably children on the obese side, children who snore a lot, or if you're realizing that your child is not able to pay good attention to his studies, could be a starting point. Necessarily not end up into a sleep disorder, but could be a starting point to at least question yourself or visit someone who can explain you about sleep.
Okay. Thank you. Thank you again. So you say the red flags are most importantly snoring, and that's a consistent, persistent snoring. When you related your example of your grandfather, I remember one of my uncles, and as children we used to say, "Hamare ghar mein sher so raha." So that was the kind of but we may take it as a joke now. But I really truly wish that we were aware about that there is something called sleep apnea back then, because we lost him. It's probably because of his breathing that he's
So sorry to hear that.
Yeah. So moving ahead again, if someone suspects sleep apnea, what's the right first step?
Probably if you think you have some sleep disorder, consult someone who specializes into sleep. It necessarily not be a sleep specialist. It could be any field of medicine. It could be dental field. It could be an ENT specialist. It could be a medicine guy. But that guy should have some knowledge related to sleep. And you cannot end up with one person, because sleep is a multifactorial problem.
I agree.
And it can need multidisciplinary approach to solve it.
Okay.
It needs a bit of time for the medical professional to understand what your problem is, and then probably give you a much better approach. With dentistry, what we've realized is sleep disorder due to breathing is a lot of an anatomical, in simple ways, a lot of geographical problem.
Correct,
of
like you
mouth.
mentioned, maps and geography.
Maps.
Mapping of your anatomy.
Yeah. So, I would consider myself fortunate that I can provide a good geographical solution to your geographical problem, which is really effective in terms of. So, definitely go ahead and speak to your specialist, whoever it is around you.
Okay, so the first step is, what I feel is awareness.
Correct.
Knowing that there is some problem with you.
Correct.
The acceptance, and then moving to someone who is professionally qualified to help you.
Correct.
Right?
Correct.
Do you think we are moving in the right direction in preventing sleep issues rather than just managing them? I'm speaking in terms of the medical industry and from the patient perspective.
Yes, from the medical industry, yes, we are moving ahead, because there are a lot of people, a lot of doctors, professionals that I see are training themselves into this field of sleep. Although sleep does not itself is seen as a different specialty, but definitely I look forward that happening very soon.
Okay.
But a lot of other specialties are coming into this, which is a good sign. In terms of patients' awareness, what I've realized is, leaving aside all the bad things about social media and digital platforms, which itself have bad effect on the sleep, but with the help of these, people like you and a lot of other people who are speaking on sleep have been able to get into the brains of people that there is something called as sleep disorder due to breathing issues. There is something called as sleep apnea, and maybe more people are questioning on the internet as to why this is happening. I see good advancement in the terms of awareness of something like this exists. What I would appreciate is people start taking steps
Correct.
to correct them, and that is what I think would be the real success, where we say that yes, the medical field has advanced well.
So what you're trying to point out is acceptance is important. Awareness is being created.
Correct.
The fact that you need to accept that snoring chalta nahi hai.
Correct.
Right?
Correct.
So that's what the patient needs to understand.
Correct.
That needs to be addressed.
Right.
Right?
Right.
Any advice you would like to give our audience in terms of understanding and preventing sleep disorders?
Yes, first is start giving importance to sleep. Very, very underestimated topic, a very, very underestimated daily routine habit of us. 1/3 of our life we are sleeping. Now, if you calculate 8 hours in a day, 7 to 8 hours in a day that we sleep, that is 1/3 of the day. 1/3 of our life goes into sleeping. And if you're not doing the 1/3 recovery part well, we are not probably giving good time to our body to perform well in the remaining 2/3 of our time. So start giving good importance to that. If you are diagnosed, first of all, if you are having some snoring issues, some breathing issues, get them checked, assessed. If you're diagnosed with sleep apnea, do not underestimate that, because effects of it can be really dangerous. It can also lead to the eventual problem of death, as you mentioned, possibly, may not happen. This is not to scare people, but this is just to make them aware. Where I have realized is, I usually tell, being a guy, I would take the side of my male friends, that the wives feel, proud that by nudging with the elbow, they stop their husband's snoring. You're not doing any good for your husbands. All you're doing is disturbing his sleep. Because he was deep into his sleep is why he was snoring. All you've done is awakened him. So the thing what his brain would have done of awakening him is what you've done. Probably nudging से आप क्या कर रहे हो? You just waking up your spouse and doing the job of the brain, which would eventually wake them up if they are not breathing. So rather than nudging, probably take them to a specialist who can take care of their snoring. And trust me, they will not be able to thank you enough for the improvement that you've got.
So basically you're saying don't nudge them while they're sleeping, nudge them while they're awake.
Correct.
So that they go to a specialist who will be able to help them better than just your nudge.
You put it into absolute right words. Yes. So another thing is very cliched, as we discussed. Get into healthy lifestyle.
Correct.
Good mental health, sound emotional health, and all of this is going to collectively help your sleep. It's not only the devices that work into our lives. A lot of behind the scene stuff also works. So give importance to that, work on them, and hope everyone has a beautiful life and a beautiful sleep.
Thank you. Out of the long conversation, Dr. Mitesh, that we have had, and I really appreciate you giving us your time. Sleep affects not only how we think, how we feel, and how we show up every day. It is also an important thing to assess what it is going to bring in the long run.
Correct.
Right?
Correct.
So the red flags, as you pointed out very appropriately, are snoring, broadening of the jaw, obesity, lacking attention while you are awake during the day, sluggishness, and this could be in adults as well as children.
Let me correct, it's not broadening, it's narrowing of the jaw.
Okay, it's
broadening
narrowing.
is the correction.
Okay, so it's narrowing of the jaw.
Correct.
So if today's conversations sparked a question, a realization, or even a little concern, that's a good thing. I truly believe awareness is something that is most important. It is the first step towards anything that gets better. What do you say, Dr. Mitesh? What do you think?
When you say thank you to me for giving my time, I would say it's worth the time if even one patient is helped with our podcasts to have his sleep improved.
Thank you. Thank you. That was really nice of you to say that. To the audience, I would like to say this is just the beginning. We are here and we will continue. We are here to fill up the gaps between what you understand about your health and what the specialists want to bring to you. Thank you, Dr. Mitesh, for sharing your insights and your experience. And dear audience, thank you for being with us through the entire episode, bearing with us, and I hope you have learned and understood something, and something that you were not aware about. Because this is just the beginning. Until the next time, sleep well and live healthy. There's one thing that I would like to leave you with: an action in time saves 9. And like Dr. Mitesh said, they prescribe to you MAD to help you not get mad.
Correct. Use MAD to not get mad.
Thank you, Dr. Mitesh. Thank you for your time.
Pleasure is mine.